The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to this webinar on a pharmacist's approach to holistic care. Before I properly introduce myself, I just want to thank St. Louis College of Pharmacy and the Alumni Association for having me present this powerful message that I'm very passionate about. My name is Bryan McElderry. I'm a 2016 graduate of St. Louis College of Pharmacy and a holistic health and wellness consultant. So this presentation is going to be for my pharmacists as well as anybody that has been referred to this webinar that is just wanting more information about what this actually is. So I am the founder and CEO of Envision Health, which is a holistic health and wellness solutions company. And I'm currently based out of Dallas, Texas, but we serve worldwide and around the country. I specialize in gut and mental health, and I also am a life coach as well. So that incorporates all into this holistic approach to health, as well as a wellness consultant for corporations, a business mentor to wellness professionals, and a speaker and entrepreneur. So today we are going to be identifying the role of health coaching and how it can actually play an integral role within the pharmacist's scope of practice and how patients can actually optimize their health outcomes naturally through functional medicine. So I would love to take you along this evolutionary journey and kind of give you an idea of what we're going to be discussing today. So we're going to go over a history of pharmacy, the history of pharmacy, and kind of go back to our roots of where pharmacy came from, and then how actually holistic care correlates with medication therapy management, or MTM, which many pharmacists and healthcare professionals are more familiar with. How functional medicine can actually be the solution to targeting the root cause of all chronic disease. We're going to go back over a brief discussion on nutrition and then practical strategies of how this health coaching model can be introduced into your practice and actually improve patient encounters and outcomes. And then a bonus at the end, which I'll be delivering to the Alumni Association, 16 powerful questions to actually ask your patients during your encounters so you can actually pull out that information that you need to create this trust factor even more so than it is right now. So this is a quote that I definitely rely back on when I am dealing with clients, or I am continuously reverting back to my vision and mission of why I developed the business that I have now. So this is a quote from Thomas Edison, and I quote, "The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition." This is a quote by Hippocrates, who was a Greek physician, and he stated, "Our food should be our medicine, and our medicine should be our food." And we're going to kind of dive into this. If these leaders said this back in the early 1800s and before, then why can't we develop that now and getting back to our root cause? So let's go back into a little background of where pharmacy came from in the evolution of a pharmacist till today. So let's go back to the Shannon times, which is around 30,000 BC, and it supports the theory during this time that the prehistoric people actually gathered plants for medicinal purposes, and many people now are on this vegan craze, or wanting to go more plant-based, or wanting to develop this healthy lifestyle by eating more herbs, greens, vegetables, and coming up with more natural ways of healing themselves. Now more so, even if you're looking into the rise of our cannabis and making that legalized in many different states, and how it's actually being used for medicinal purposes now. During this time, illness was actually explained as spirits or disasters. If we go into the definition of a shaman, and many people might be familiar with this, you may not, but a shaman was actually the healer of the tribe. They were responsible for the healing, and they did this through just natural ways of developing, coming out with the resources that they had around them, and developing these herbs and remedies to heal the body. Then you go into the medieval times, which stated before Hippocrates, who was a Greek physician, stated that clause in that quote, that he wanted to heal the body with food as medicine. And then during this time, more plant-based information and remedies were coming to surface, and the emergence of more chemistry was coming out. So here we see it moving into more of a more scientific studies about how to heal the body with herbs, and the resources they had around them. We go into the 1800s, and during this time, the pharmacist was known as the apothecary, and many of us are very familiar with that. And the pharmacist during this time simply compounded, managed clerks. So this is where the pharmacist trust came more so when they were in the community and they were compounding and making these medicinal drugs for the community. And during this time, they employed and managed clerks around them that were helping, as we know today, as techs. In 1852, pharmacy was actually now regulated, and the APHA was founded. So now pharmacists actually have regulations around their practice and what the pharmacist can actually do. Previously, if you didn't know, physicians were more so of the compounders, and the apothecaries were practiced at diagnosing. So if we go back to Hippocrates, Hippocrates was a Greek physician, and he more so believed in this natural way of compounding herbs and healing the body that way, and not necessarily more on the diagnosing side. So you kind of see maybe some role switching and maybe some combination here with the physicians and the development of the shamans into more of a pharmacist nowadays, and how that has actually developed an integration into our healthcare field. In the 1900s, this is a pivotal time within pharmacy because we were established as practitioners. This was the time when the rise of chain and independent pharmacies came about. The requirement of educational training actually came to be, and OBRA was actually founded, which was actually in 1990 recognizing pharmacists' expertise in actually producing positive health outcomes. So this was huge because the pharmacist was still kind of just this compounder. They were the apothecary. They were supposed to be quiet and just produce these the medicinal drugs at that time, but not necessarily get into the diagnosis and the patient interaction. They were on the back burner. And OBRA kind of now recognized, hey, pharmacists are actually integral, a huge integration within our healthcare team, and should be more recognized for producing positive health outcomes. Going into the 21st century was now where a lot of automation, more pharmacy schools are coming out to be accredited. We see now, even more so in the last 5 years, Amazon has just taken over, especially with the development of PillPack, and this being a huge step because it's now requiring a lot of community pharmacies and independent pharmacies having to actually integrate mobile deliveries and utilize this technology to actually deliver better patient care. And it's not going away. We see it continuously moving as patients or people are just looking to have things at their fingertips in the quickest way possible. So telemedicine is becoming more and more prevalent. And the interesting thing is health outcomes are actually declining. They are being improved at times, but you've got to think people are becoming more sedentary. There's a lot more focus on technology. The stress of people's lives are going up, and health outcomes are actually on the decline. So how can we overcome this? And I believe through holistic health and nutrition and functional medicine could be our answer. Getting back to our roots. So we're going to dive into holistic health coaching, what that actually is, in combination with functional medicine, and we're going to describe those. So let's clarify quickly why pharmacists are important and an integral part, and why pharmacists can actually integrate functional medicine, holistic health coaching, and life coaching within their practice. Because most pharmacists are the most accessible and still the most accessible healthcare professional on the market. Pharmacists can be integrated with many different healthcare arenas and teams. As we see now, the market of where a pharmacist can actually be introduced is just becoming more and more prevalent and open as pharmacy schools are introducing many different programs, and speakers are coming in to tell them, i.e. myself, many different routes that you can take with your pharmacy school education. The pharmacist is the drug expert, all the way from the physiological level up to the medicinal complex chemistry of drug development. The pharmacist is trained in interpersonal patient counseling. We are the face at times with the patient after they are in the community setting. It could be in the clinical setting. It could be, even if you are a consultant pharmacist and you're dealing with more nursing care facilities, you're independent pharmacist. Even if you are traveling within a big pharma industry role, and you're going and having to do presentations at times, and maybe you might encounter some patients. So this is very important, that a pharmacist can be integrated in many different arenas and actually incorporate holistic health into what they're doing currently. So let's go ahead and describe exactly what holistic health coaching is, because I am so passionate about what I do now. I absolutely love it. I wake up every day just excited to serve and to tell my story and to tell how this could potentially, and I have seen with my clientele, change people's lives. So let's go ahead and describe this. So a holistic health coach is a trained professional who actually use an integrative approach to both diet and lifestyle changes to improve their clients' or patients' health. They're working towards an overall healthier lifestyle as they analyze nutritional patterns. We analyze relationships. You analyze physical fitness and exercise, their spirituality, and just the day-to-day livelihood. So again, gaining a holistic approach to what your patient or client is actually dealing with. So let's describe what the difference is. You see firsthand, a health coach simply implements support. That is the base level: accountability, behavioral change, and this ideal of coaching is becoming more and more to surface when you are looking at business coaches, life coaches, health coaches, mindset coaches, relationship coaches. So if you go back to the root the root definition of what a coach is, if we remember, if maybe you played sports or you had just some coach in general in your life, it could be a mentor if you want to call it that. That mentor guides you, that coach pushes you and guides you and teaches you so you're able to self-sustain. Many times I look at teachers as coaches. You look at professors as coaches, because when you move on to the next grade or the next level, or you step outside, as I've stepped outside of St. Louis College of Pharmacy, you never forget what that teacher or that coach taught you. They're guiding you, they're giving you support and inducing these behavioral changes. They're becoming an integral part of your life. So a functional nutritionist or holistic nutritionist, this is kind of the realm that I fall under right now currently, as a functional and holistic nutritionist combined with a health coach and a life coach. So a nutritionist cannot necessarily diagnose, but we can prescribe protocols, diets, recommendations. But again, if you're not as a registered dietitian, which I am currently not, you have to comply with state and regional requirements. So certain states around the country in the US, you have to be careful about what dietary recommendations you give. So definitely check with your state and see what that might be for you if you're looking to go into this. But as a registered dietitian, of course, this is where you're most familiar with giving nutritional advice in the clinical setting, because a dietitian can prescribe, they can diagnose, and they can recommend more on a clinical basis. But what I've seen currently is that with me giving functional and holistic nutrition, as a holistic nutritionist and a health coach, I'm still able to implement change within my clientele without actually having to prescribe anything per se. But I always have clauses and disclaimers, and I have contracts that I have with my clients that definitely designate actually what I'm doing, so I am not liable. So let's go into, I keep talking about this root cause, correct? If you look at the top of this diagram, you will see obesity, fibromyalgia, arthritis, diabetes, cancer, heart disease, and autoimmune diseases. These are diseases, as a pharmacist or a healthcare professional, if you're listening, um, that are most familiar with. These are the things that are plaguing our society currently that patients and clients are dealing with. And we're looking at it on a surface level, trying to treat these, manage these, switch medications, switch protocols, and guide the patient or client along. But what we're missing is the root cause, the underlying cause that many of us are maybe familiar with because in our studies, if you're a pharmacy student or if you're a seasoned pharmacist, our studies have these etiologies, these root causes. We learn about these things, where they're stemming from, but are we actually targeting them when we are helping our and guiding our patients and providing recommendations? As you can see here, many of them are hormonal. You see a lot of imbalances with the immune system, digestive system, the microbiome. As you see there on the bottom left, toxic emotions. So the emotional state of many people, anger, fear, resentment, and how stress can cause these imbalances across the board, which goes up into the surface level where you're dealing with these chronic disease states that we are so prevalent with. So let's dive into the gut-brain connection. Some people might know exactly what this is, some people might not, but this is where my focus is now, on a deeper level when it comes to more of the health side of things, not just the surface level, but diving deep to the root cause, as we've already stated previously. So there's a gut-brain axis which connects your gut, your intestines up to your brain. And as you can see in the diagram, our brain actually sends signals in our CNS, to it controls our motility, our secretions, our nutrient delivery, our microbiology, and then our gut sends reverse signals, and it just a continuum. And this influences stress, anxiety, mood, behavior, sending neurotransmitters both ways. So again, this is where a lot of chronic disease states, mental health, that you see here, associated chronic conditions, anxiety, depression, autoimmune type 2 diabetes, hypertension, even pain that's induced from inflammation in the gut, to where it's sending signals now, where we're dealing with a lot of fibromyalgia, a lot of different autoimmune diseases where it's causing these Crohn's, where people are having pains in their extremities, and what is the result? They're being prescribed pain medications. They're being prescribed antidepressants. They're being prescribed and managed on a lot of chronic medications. And you can see here that if we're able to kind of take a step back and look what is really going on with your patients, or if you're listening from a layperson's level, what is really going on, and maybe asking your physician or your pharmacist or your healthcare professional, hey, can we talk about this a little bit more, and tell me what's really going on, so you can better understand these conditions. So again, holistic health coaching, it's a technique that empowers patients to make a lasting health behavioral change and improves their overall well-being. What I've seen most common with my clientele is when they're able to get control of their health by just simple lifestyle recommendations, understanding nutrition from a base level. This a continuum chain where I see them lowering their stress levels. They're not as stressed as much because now they're more excited about and waking up with energy and vitality, and their productivity is going up at their workplace. They're happier in their relationships, which as a result, their biomarkers are going down, their blood pressure levels are going down, their A1Cs are going down, their some of them have even gotten off their antidepressants, and it's just amazing to see that just by simply being a support system, providing valuable knowledge and education to people so they can understand and take control of their health. As you see here, other healthcare professions, nursing, some family practitioners and physicians are actually inducing health coaching within their practices. And nursing is probably the most prevalent because it's actually recognized by the American Nurses Association. And pharmacy is still yet to tap into these patient-related benefits of health coaching because it can be implemented on its own. We're going to go into how that correlates with medication therapy management, but also even some insurances are covering health coaching under their coverages and their benefits. So what is functional medicine? We talked about holistic health coaching, now talking into functional medicine. And this is getting more into systems biology. And as a base approach, it focuses on identifying, addressing the root cause of disease. Because each symptom and differential diagnosis may be one contributing factor to an individual's illness. What that means, essentially, is if we're looking at one sign or symptom, automatically diagnosing, automatically treating, and it creates a spiral effect that many pharmacists see when they're managing 5, 10 medications. Physicians keep prescribing. So where should we develop this team, this network of healthcare professionals that are creating this patient-centered approach, which we solely focus, we try to focus on, but it gets disconnected at times. Functional nutrition is a subcategory of functional medicine where it's focused primarily, as stated, on nutrition and how it can actually restore the physiological functioning of the body. So again, going back to the Shenandoah times, the medieval times, even the shaman, the healer of the tribe, going back to a natural state of the body, because as we induce more chemicals and medications and things into your body, it throws off your hormones, it throws off those imbalances again, and your body is now fighting against that. And you also have to maybe induce more medications or more things into the body to rebuild that physiological natural state that your body was born on. So what's the problem? As you see here is a general diagram. Again, the whole evolution. I'm very big on the evolution of where we came from, even as pharmacists, as people, and why are we our lifespan is shorter than maybe our predecessors, even your parents, your grandparents. If you're more in your late 20s, early 20s, even now as a millennial, mid 30s, it doesn't matter necessarily, but we are gradually declining in our health. And why is that? As you see, we are becoming more educated, which is fine at the top, but now we're becoming more sedentary, which relates to having to eat on the go, grabbing what we can. Technology is now becoming, as we're on this webinar virtually, becoming our form of communication, and it's becoming a detrimental factor to our health. So chronic disease states in America, this is developed and brought from the CDC. And our leading causes of death and disability is around 3.3 trillion in annual healthcare costs from just chronic disease states alone. And 90% of that is coming from the chronic disease state and mental health. So again, my focus now is on chronic disease and how that correlates, as we talked about previously, with your gut health, your gut-brain connection, and why so many people are dealing with a lot of mental health issues. Even your most successful people, right? They're dealing with these struggles, and you're wondering, why are they so unhappy and depressed or anxious? And you can see here, 6 out of 10 adults have chronic disease, 4 out of 10 have 2 or more. And it's just becoming, a problem. And you kind of see the risk factors here, where tobacco use, poor nutrition, lack of physical exercise, excessive alcohol use. But again, my question as a holistic health and life coach that is focused on prevention and diving into the root cause if I'm looking at a person that's dealing with tobacco or alcohol use or doesn't want to exercise or doesn't want to eat healthy, that's coming from and stemming from something a little bit deeper. So I ask questions about what they're dealing with at home, environmental factors, economic factors. Why can't they maybe purchase some medications? Why can't they purchase some healthier options? And trying to come to where they are, place myself in their situation so I can better help them and guide them and talk and relate to them instead of talking down to them or talking to them. I'm talking with them. Because again, it's focused on support, accountability, and providing that guidance so you gain better trust because they seem to feel like you understand and you care. And not to say we don't as pharmacists or healthcare professionals, but at times we can be so educational that it comes down to where we're not relatable with our patients or clientele. Increase in prescription drug use. This is huge. We know this as healthcare professionals and anyone else, this is on a rise. And you can see here, this is from the National Health and Nutritional Examination Survey, where it is stating from around late 80s to now into the 21st century up to 2014, a couple years ago, we see this rise of medication, even from our younger generation, 18 to 44, here on the right-hand side, and then all the way up into our elderly, where more and more medications are being induced, 5+ more drugs, and it's just getting out of hand. So instead of inducing more drugs or more medications coming to market, how can we reduce this capacity and get back to just our natural state of functioning of our bodies? So this was a study taken where it was looking at the correlation between lifestyle intervention and metformin, which is as we know, our primary source, or excuse me, primary recommendation for type 2 diabetes. And you can kind of see here on the diagram that there's a slower cumulative incidence of diabetes percentage wise over a course of around 4 to 5 years, where the lifestyle change is a slower gradual increase of the cumulative incidence. So what is the difference? We have medication therapy management, or MTM, and then we have holistic health coaching, functional medicine, functional nutrition. And well, Bryan, we already have medication therapy management. We're doing education. We're reducing medication usage. We're trying to do that. But again, the missing piece that I've seen is that the medication therapy management is, again, focused solely on medication. It is solely focused on this, and the patient or your client or whoever you're dealing with is simply not getting healthier. Yes, we're removing certain things from their medication regimen. We're reducing the medications they're on. But again, is this instilling lifestyle behavioral change, or is it just taking them off a medication and they're still on medication, but they still haven't developed these lifestyle changes that they truly need to get off medication? And that's where I've seen the most benefit through holistic health coaching, is diving into all aspects of a patient's life or a client's life, where you're looking at, again, their physical fitness, their spirituality, what their beliefs are, their family life, their relationships, their support systems, their work life balance, all these different factors that could be a result of why their health is on a decline. So let's go into a little bit of nutrition. As healthcare professionals, we are not very well trained in this area unless you're a registered dietitian. And even then, a dietitian or even some of your nurses are not keeping up with what the community or society is reading in blogs and Google searches, and what is actually working for them when it comes to all these different dietary regimens, what new studies are on the market, and what is true and what is not true. So again, it's lacking in our healthcare professional schools. Patients are coming to you asking, "Hey, what is CBD? Can I utilize it? What are the right vitamins or supplements that I can and use with these medications, or what can I supplement to get more nutrients in my body so I don't have to be on these medications for much longer? Because a lot of patients think that this is a death sentence. They come into you and they think that diabetes or hypertension or a chronic disease state, their physician has just given them the news, and they are struggling with this, that they have now been given this regimen of medications, and they're stuck. They feel stuck, and they think it's a death sentence, and they think they're going to be on it for the rest of their lives. And at times, yes, you do have to have that. I'm not saying that medicinal purposes and medicinal regimens are not lifesavers for certain people, but the grand scheme of things, many patients don't have to be on these medications. So 95% of physicians believe it's beneficial, but only 6% of physicians actually refer to a registered dietitian, a health coach, or a nutritionist. And about 12% of physicians actually incorporate nutrition into their own practice. And as a result, patients in society are falling victim to learning on their own. So we're all too familiar with this food pyramid, but this is now obsolete. As we look a little bit deeper, you see milk, cheese, and dairy, 3 servings of that. Meat, fish, alternatives. What type of meat? Lean meats? What's good for you? What's heart healthy, quote unquote? What fats, healthy fats, should I be taking in? And we see here that we want more bread, cereals, potatoes, but what type of bread? What type of cereal? Fruits and veggies. What types of fruits and veggies? Are some of them good? Are some of them bad? Are some of them inflammatory or anti-inflammatory? This is from a base level that people are still going off of, and it's obsolete. So who is covering the maintenance? We've got car insurance, we've got health insurance, we've got other protectors around us to cover us in the state of a disaster. That is what health insurance is for. That is what car insurance is for. You have many different protectors around you depending on where you live. And why don't we have any preventative measures for our health, our well-being? Because if we look at health insurance, that's for primarily disasters, but it's being utilized for things that are preventable. So what's the solution? Where can pharmacists step in? Treating the person, not the symptom. So we're trained in this, that we treat the person and not the symptom or disease state. But a lot of times this is forgotten about, and we're not diving deep enough. If you see on this diagram, this is just showing that there are many different factors that are going on when it comes to a person's health, their nutrition, how nutrition is affecting their mental and emotional wellness, their immunonutrition, the vitamins and supplements they're getting, and how that's affecting them, their metabolism, their metabolic state. How are all these things from their nutritional regimen affecting them to now where they're having to take medications to combat that? I'm so confused. FAD diets, vegan, Atkins, Whole30, vegetarian, Mediterranean. These are questions that a lot of healthcare professionals are getting, myself included. But I have tried almost every one of these as I went through my own journey around 7 or 8 years ago. During my matriculation at Stillcop. And what I have found is that each of these dietary regimens could work for somebody, or they could be detrimental. But marketing, ads, incorrect information that's been given to your patients, maybe yourself, about going vegan, performing a ketogenic diet, going on a low carb diet. But is this detrimental to your overall health, and is it actually stressing you out a little bit more than you think? So let's go into this diagram really quickly, and this is my point being to why each of those diets need to be dove a little bit deeper. So too much of anything is bad for you. We know that, right? As you can see on the left and the right, this is a diagram showing that it's the same food source, right? And if you go back to the food pyramid, you're incorporating the same things. Bananas, some peanut butter, some nuts, some seeds. You have oats in there for whole grains and fiber, and it's heart healthy. But now, look on the right-hand side. What looks like the difference to you? We don't know how much you're inducing into your body. It's very important. Excuse me. So, is your meal plan too restrictive? These are the meal plans that are being delivered at your hospitals and your clinical settings, even in your outpatient settings. Some registered dietitians or nutritionists are still giving some of these regimens out in their pamphlets, in their health clinics, their health fairs, where it's so restrictive that if you look at it from a base level and you look a little bit deeper, into the things that are included in this regimen, you see a flour tortilla. Should that be whole grain? Is that inflammatory to the gut? You see margarine, butter. Yes, that's fat. So is that compromising your patient's health? Scrambled eggs, is that a whole egg? So you have your cholesterol in there, but again, there are healthy fats and nutrients in that yolk, but how much is this right for your patient or your client? Fat-free milk, again, dairy products, or is this being inflammatory to the gut, and now you're having to deal with autoimmune diseases and pains and aches. You see on day 4 all the way to the right at the top hand side, you see grapefruit. That's an interaction for some of your medications that you're managing or prescribing to your patients. So the overall gist of this meal plan is just so restrictive, and it still could be detrimental because it's not quote unquote healthy. So, what is the solution? And this was described in our pharmacy school curriculum, and may have been described in your healthcare professional curriculum, if you are other healthcare professional. And even if you are looking at this and you have no idea what this is, macronutrients, if you look back, and I'll scroll back here to your sample meal plan, you see a 2,000 calorie food meal plan. You have no idea where these 2,000 calories are coming from. Are they coming from protein, carbs, fats? Is there an equal distribution across the board? You can get a 2,000 calorie meal from McDonald's, correct? So are we breaking those 2,000 calories down into the right protein, carbs, fats for a particular dietary regimen? If you look at all the diets that I described previously here, ketogenic, Weight Watchers, vegan, vegetarian, Mediterranean, each of those dietary regimens can be broken down into protein, carbs, and fats. Ketogenic diet, we increase the fats, you increase the carbs, lower the protein, you lower the carbs, and you have a moderate amount of protein. Again, all based on macronutrients. So this is a confusing factor for many people. You're looking at nutritional facts, labels. You're being told to look at labels, what to watch for, what to not watch for. What I want you to focus in on from a base level is the amount of total fat, total carbs, total protein. These are your 3 macronutrients. And another factor I like to look at is dietary fiber, because this is going to induce the proper digestion. You're going to remove toxins from your body. And then I simply glance at the sugar. Many people might be questioning the sodium in this particular item. Sodium, yes, is important for many chronic disease states, and it should be watched and monitored. But if you're drinking enough water, around 1 ounce per pound of lean body mass, then this is going to be a natural flushing mechanism for your body. So the resulting solution is quantity plus quality is going to equal optimal health and weight loss. But many times we're focused just on the quality, but we're not focused on the quantity that we're taking in. And this is producing maybe a negative effect for either your health or your patient's health or your client's health. So if you're looking at a grasp of this whole presentation, this whole webinar, what I want you to get from it is that Healing comes from within. It's internal. It's an internal motivational factor that we must dive deep and pull out of your clients, pull out of your patients, pull out of yourself, that you have the power to heal your body with natural ways of doing so. And you can be an advocate for this by incorporating motivational interviewing, motivational factors, asking the right questions to your patients, your clients, asking the right questions to yourself about what a healthcare professional is and should be to our society and our communities. Be an advocate for reduced medication usage, because what this is going to do is not only will we be able to manage medications that are crucial, but also reduce those biomarkers in our most prevalent disease states that are crippling our society, which is chronic disease and mental health. And how can we do that? Through alternative solutions, through nutrition, natural supplementation, lifestyle, and behavioral change that's going to create this holistic approach and healing to your patients, yourself, and your clients. So thank you so much for listening to this webinar. I hope this was informational to whoever was listening. And if you would like to connect with me, I would love to connect with you. There's my email down below, Dr. Bryan at envisionhealth.com. My business website, which is envisionhealth.com, as you can see, it has a Z in it. And then my social media handles, you can find me on all social media networks at Dr. McElderry on Twitter, Instagram, Facebook, LinkedIn, and I would love to connect with you. Please shoot me a message if you are looking to incorporate this into your practice, incorporate this within yourself, and how we can spread this message of holistic care across the board from our pharmacists, our healthcare professionals, our healthcare teams. And if you're listening to this, empower your healthcare professional. If you have one that is maybe not privy to this, ask the right questions. Say, hey, I would love to see about another approach to my care. So thank you guys so much. I truly appreciate it. And I hope you got some benefit out of this. And I look forward to connecting with you soon. And thank you to St. Louis College of Pharmacy and the Alumni Association again.